This is a presentation for the ACL All-Stars, an injury prevention program for female high school basketball athletes. Group members include Rafael Alvarado, Samuel Beltran, Ivan Dukusin, Alexandra Rolda, Anthony Tran, and Brooke Shimazaki.
The target population for the ACL All-Star Prevention Program will include high school female basketball players ages 14 to 18, given the higher rate of ACL injuries experienced in the female population as compared to their male counterparts. Environmental challenges to our target population begins with Title IX's inability to address certain gender discriminations, such as reduced funding in female programs and inadequate quality of training and education. A social factor includes the effect that overtraining can have on an athlete's health, such as chronic pain, lack of sleep, and fatigue. Factors as an athlete can also affect behavior, as increased demand of competitiveness and pressure to perform can lead to stress, anxiety, and altered sleep or eating patterns. Ecologically, sports as a whole is impacted by both financial socioeconomic status, as parents with greater income are more likely to have their children participate in early specialization of a sport, thus increasing risk of injury.
So out of all professionals within the sports performance realm, why physical therapists? The main differentiating factor between PTs from athletic trainers, personal trainers, and strength coaches are that PTs are well educated on the body's neuromuscular system and know how to utilize techniques to restore normal movement patterns. What is the neuromuscular system in re-education? The nerves and muscles in our body communicate to produce movement. Without that communication, movement wouldn't occur. Nerves send signals between the brain and muscles about movement, like when to move, and how fast to move. Proper re-education will strengthen this communication and produce optimal movement patterns. In the same thread, if improper communication is utilized, this will promote poor movement patterns and increase the risk of injury. This allows us to implement an individualized, comprehensive injury prevention program that includes sport-specific exercises that are optimal for maintaining a healthy sport career.
The ACL prevention program will utilize the CD Synergy planning model because it has 6 phases to help identify the problem within the target population, plan the intervention, develop the intervention, evaluate, and implement the plan. This program addresses 4 out of the 5 overarching goals outlined in the Healthy People 2030 framework from the U.S. Department of Health and Human Services. The overall goals of the ACL prevention program are listed here on the slide.
One of the things that sets our program apart is that we are providing services tailored to ACL injury prevention for the specific population of high school female athletes. We have a strategic partnership with 19 Sports Medicine Group in San Diego that has an existing program that caters to ACL injuries but primarily focuses on recovery from injury. Through our collaboration, we will have a greater emphasis on prevention of injury. ACL All-Stars will be working directly with schools to provide services on-site, creating a better opportunity for those who may lack transportation or funding. Functional evaluations will be performed in the preseason, with teams following our ACL injury prevention program 2 to 3 times per week, which will be seamlessly incorporated into their practice routine. Over the course of 6 months, our team will evaluate the efficacy of the program by collecting pre, mid, and postseason data.
An educational supplement will be provided for the athletes to take home, which will include pictures on a few exercises that will be performed, including what the correct form should look like and what a common mistake looks like. That way, they can continue to perform the preventative exercises without the direct supervision of the physical therapist. Here we have an example of proper landing form. Notice how on the left picture it shows the correct form and the right shows an exaggerated incorrect form. Additional information on optimizing performance and injury prevention will also be included, such as tips on better sleep habits, nutrition, avoiding overtraining, and an active resting program.
Patient satisfaction will be measured by a 10-item questionnaire collectively written by participating PTs. The questionnaire provides the PTs a perception of how the athletes perceive the program, their PT, and goals. The KOOS for children was chosen due to having a specific section dedicated to sports-related movements. The PETI IKDC was chosen due to the sports-related activity section. In addition, an article about ACL management with basketball injuries reported using the IKDC as their preferred outcome measure. Desired outcomes from the post-satisfaction survey would be to have high athlete satisfaction. Desired outcomes for the knee-specific outcome measures would be to increase knee functionality.
We'd like to thank you for attending this presentation on ACL All-Stars and hope that you consider integrating us for the success of your team. We can take any additional questions at this time, and you'll find the references for our information on the following slide.